Hi, this is Dilhan from First Point Physiotherapy. At least once a week, I get asked in the clinic, what is the best sleeping position? I also get patients who wake up stiff and sore in the morning, and I have patients who dread going to bed because they can't get comfortable. So I just thought I'd address this issue and give you 3 tips to help you get a good night's sleep and wake up fresh in the morning. Okay. So most of us, on average, will sleep 6 to 8 hours in a night. So similarly to the way where we work. So we work for 6 to 8 hours on average. So similar to the way we assess our position, our posture, or even our lifting technique for that matter, if some of us do a manual job, I think it's important to consider the position that we're sleeping in as well, because we might be in that position for a very long time. So the important principle with the sleeping position is understanding what the optimal position for our spine is. So that's understanding the position which places the least amount of stress through the structures in our spine, such as the discs, the joints, or even the muscles. So let's move on to tip number 1. So the first thing is try and avoid sleeping on your stomach. Okay, so sleeping on your stomach, if you use a pillow, what that's going to do is you're going to have to turn your head to the side in order to sleep, and so that's going to place your neck in a position of extreme rotation, and if you're like that for a very long time, that's going to cause a lot of stress and pressure and loading through your neck. Okay. Also, some of you might like to sleep with your leg pulled up to the side as well. Okay, and that's also going to place some stress through your lower back as well. So let's just take a quick look at that. So if you're on your stomach, okay, your head's just going to be to the side, okay, your neck's going to be fixed like that for say 6 to 8 hours, which is not going to be great. Okay, and similarly, if you bring your leg up like this, okay, that's going to place a bit of stress through your lower back, okay, and put it in a certain amount of rotation. Okay, so leading on to the second point, the ideal position for you to sleep in is on your side, okay, or your back. So if you do sleep on your side, you just want to make sure you have your pillows at the right height. So you want your head to be in a neutral position. So pretty much like the way I'm sitting now, okay, so my head's straight, okay, you just want to convert that into a horizontal position. And the side on view, okay, your neck, you don't want your neck to be too far forward, okay, or too far back, okay. And similarly, if you're on your side, you don't want your head to be pushed to one side. So if you're stacking up pillows on one side, then that's going to push your neck up, okay. It's going to compress the other side and overstretch this side. And similarly, if it's too low, okay, your head's going to be down, okay, which is again for a long period of time, it's not very supportive for your neck. It's not maintaining an optimal position. Okay, so maybe just consider that. Have a look at how many pillows you're using or the height of your pillow tonight when you go home. The third tip is, okay, try not to sleep with your arm tucked in underneath your pillow. Okay, so I think we've got some poor connection. So if you're like this, okay, with your arm underneath your pillow, okay, like that, okay, that's going to put a lot of pressure and stress onto your shoulder structures, so the muscles, and also some of the blood vessels and nerves, okay, which run through that area as well. So you might feel some numbness or tingling or even just pain if you have a shoulder injury. So try and avoid sleeping with your arm underneath your pillow or tucked underneath your head. Okay, so there are 3 tips that I'm going to recommend to you. So if you find these useful, or you know someone who might find it useful, just tag them, or you can share it, or you can like this post as well. If you have any other questions, then you can always just private message me in Facebook. Okay, so don't lose any sleep over it, but maybe go home tonight, or have someone look at you when you're sleeping, and then you can try and help yourself get into a better position. Happy sleeping and have a good weekend. Thank you.